So time now for this morning's edition of the Bronson Health Chats, and joining us, Medical Director, Bronson Trauma and Emergency Center, Dr. Oreste Romeo, and good morning to you, sir. Thank you very much for joining us this morning. Looking at, injury related to diving is one of the more common injuries that we're seeing in the summer months, and that can have, of course, a life-altering outcomes, diving being one of the most preventable causes of spinal cord injuries. It's also the fourth leading cause of spinal cord injuries for men and fifth leading for women. So when we come across injuries resulting from swimming accidents, particularly diving, are more common in the summer months. Do you see these types of injuries happen often?
We see a fair frequency, I would say. The extent and the severity of which is really dependent on several factors, but we do see a fair number of spine injuries that are produced by diving in shallow water, particularly by the lake or in pools, in the parts that shouldn't be diving sections and oftentimes are flagged as such. Patients are brought to us after having been somewhat careless of the signals that are posted.
What kind of outcomes occur from these type of diving injuries?
Well, recognizing that the body becomes, if you will, in the position upside down where the head strikes the ground or the surface, loading the cervical spine. Injuries can be as simple as a strain to as severe as a devastating injury that results in fractures and cord injuries that can lead to either paraplegia or tetraplegia, so inability to regain function of the upper and lower motor structures of the body. And the extent, again, goes with the type of surface and shallowness of the water the patient is immersed in.
Of course, being the medical director there for Bronson Trauma and Emergency Center, how is Bronson equipped to handle these type of injuries?
Bronson is a level 1 trauma center. Is the regional designated center to have all specialties available from, in this case, neurosurgery and orthopedic spine specialists to down the line on recovery portions of the care. Being able to provide the rehabilitation, which extends in these situations often for months after the recovery has been achieved, depending on the functional status and degree or level of the injury. But we have essentially all the available specialties that can assist with the care and the recovery.
Now, of course, we don't want to, scare anyone. We want to make sure that folks have a happy and safe summer, of course. So what type of tips, then, do you have for safe swimming?
I think the first thing is just use common sense. Avoiding alcohol is a very important tip. Oftentimes the patients are diving at a party and, being careless or not minding the signs that are indicating a no diving section to a pool, shallow water, water hole, any form of diving that, should be, I guess, paying attention to the signals is the first thing. It's very important to enter the water feet first if possible, particularly if there is a grading into the water, and never diving into the shallow end of the pool, knowing that lakes, rivers shift their beds, and as such, an area that might have been a little bit deeper last summer might be posing threats, this oncoming time around. And it is important to recognize that the faster the entry of the water, the higher the kinetic load the neck is going to potentially take. So coming into the water with gentle approach is always a very important thing to do. And, just using common sense is what I would stress, being very mindful of the surroundings, the type of waters that you're entering is very important.
And of course, if you do come across someone who is injured in this type of situation, the first thing you definitely want to do is probably call 911.
Absolutely. Yep. We have very skilled teams on the ambulances that can assist with immobilization and the immediate transport and all the care that is corollary to the transfer. It's very important not to try to move the patient or try to drive the patient in, as C-spine needs to be maintained immobilized until the rescue is completed.
Dr. Oreste Romeo joining us this morning for this morning's edition of the Bronson Health Chat. Thank you very much for your time this morning, and hopefully everyone out there continues to have a safe summer.
Thank you for yours.